There we go. Okay. Hi. All
Hey
right.
Beth,
Hi, Dr. Zoumalan.
how are you?
Great. How are you this evening? I guess it is already.
We're doing great, enjoying a beautiful weekend in sunny Southern California. So thanks for setting up some time to speak with me.
Awesome. Well, let me just introduce you here real quick to all of our fans listening out there. Today, we're going to talk a little bit about scars with Dr. Chris Zoumalan, and he's a board-certified ophthalmic, plastic, and reconstruction surgeon, and he's the founder of Skinuva, which is a line of growth factor-based products for scars. And I'm Beth Bentley, and I'm representing the Brave Coalition today. And so we're just going to jump right in and talk a little bit about scars. So Dr. Zoumalan, you want to tell me just a little bit about the process of wound healing and why scars heal?
Yeah, I mean, thank you for inviting me. It's a pleasure. You have a wonderful nonprofit, and I'm looking forward to working more along with you and your team. As an oculoplastic or ophthalmic plastic surgeon, I do manage scars, although it's just in a particular part of the face. I don't work with breast reconstructive surgeries or patients that have undergone breast reconstructive surgery, but the process of scarring and how scars and wounds heal remains fairly consistent, whether it's the eyelid or whether it's the breast tissue. And essentially, when it comes to the ability and how a scar heals, there's various factors that basically help in the stages of the healing. One is the type of wound closure, and it's a trauma that a child gets from scraping or cutting their hand or their face by running into something, or a very surgically created incision. Those heal differently based on the mechanics of how that scar was created. So the best healing scar is the one that's closed perfectly in a meticulous fashion, that the stitches are aligned correctly. If it's a deep cut, the surgeon will often place layered closure to reduce the tension. This tension is we'll talk later about some risks that are associated with scars. And so essentially you want that wound to be cleaned. You want it to be closed as well as possible in a layered fashion to reduce that tension among all layers. And then the wound starts to heal. There's various stages that a scar or a wound goes through. In the beginning, it's just the blood, it stops bleeding. It's called the hemostatic phase. That's like a day or two. So if you cut yourself, there's a scab that forms and immediately bleeds. That's the initial phase. And then from that course on to the next week or two, there's a lot of internal processes that are occurring below that scab that you see, whether there's a suture or not. And there's a lot of growth factors that your own body sends out as messengers and essentially tells your skin how to heal. Some people tend to have a robust amount of growth factors in certain areas, signaling more of a reddened scar, or a thickened scar, or a hyperpigmented scar. Some people don't. Their scar heals less red, less thickened, less pigmented. And there's a lot of risk factors for that. But ultimately, a scar goes through these stages, and it can be up to a couple of years until that scar finally matures. So a lot of patients come see me and say, "Oh, I'm still not healing well, doctor. Well, is my scar going to be okay?" And the patient's about a month out from surgery. Well, that's when the scar reaches the final stage of healing, which is called the maturation phase, where it starts to mature. Meaning when it matures, the wound contracts a little bit, the redness gets better a little bit, the thickness gets better, it starts to thin out, the itchiness gets better, the dryness sensation gets better, and it starts to become a stronger scar. So it can take up to a couple years. So that's kind of the process of how a scar heals.
Okay. And you talked about risks for scars. Are different people more at risk than others for scarring?
Yeah, there's a lot of discussion about this, and obviously I want to base this all on science. So when we look at risk factors, we do find that younger people tend to be at they're high risk for scars, and because they have a more prominent response to an injury. So they have these growth factors, like we talked about, tend to be secreted in a higher amount and in different concentrations than someone that's older. Someone that's older has a more attenuated response. So they also may not heal as well. They may be at more risk for the wound opening up if it's not properly closed. They may be at more risk for infections if they're older and maybe even immunosuppressed. But a younger person tends to be at more risk for scars or hypertrophic scars, meaning they're really thickened and even keloid scars, which we'll talk about in a sec. But and genetics. So if you have a family history of keloids, you're probably more at risk for having it, although it's still a very low risk overall. Allergies. I've seen this in one patient recently. If someone has a very prominent history of allergies, they have a really prominent issue where they have a, significant response from mast cell reaction and allergies, can also indicate a higher risk for hypertrophic scars or keloid formation, which is very interesting. It's rare. That's something to watch out for. And other skin color, people that studies have shown that people with darker skin, Middle Eastern people, Hispanic ethnic origin, African Americans, tend to be at a higher risk for keloid formation, hypertrophic scar formation. Although it's still a pretty low incidence, it's about 1% or so. It is higher than the overall population. But those are some risk factors that we kind of take into consideration when it comes to who's at risk for hypertrophic scarring or keloids.
Okay. And just out of curiosity, when you talk about young versus old, I think it's relative to who you are. Like, are you talking like pediatric, or are you talking under 60?
Great question. There's in general, younger. So someone in their teens, 20s, 30s, 40s versus someone in their 60s, 70s, 80s. I think it's a situation more in general. It's the way the body responds to scarring. So there's no like cutoff. Well, that's the teenagers. In general, younger people tend to have a more prominent scar response than older people in general.
Okay.
Yeah.
And you talked a little bit about keloid. Can you just discuss that a little bit deeper for some of us that don't know that much about scarring?
Yeah, keloids are not that, I don't see them often in my practice. In fact, keloids are incredibly rare. I get to see one on an eyelid. It tends to be, definition of a keloid is essentially a scar that basically, when the tissue is so significant that it extends beyond the boundaries of the original incision or scar itself. So hypertrophic scar could be a scar, if you have like an incision, let's say, the video works here, like an incision here, the hypertrophic scar still remains within the boundary of that incision, but it could be a little bit thicker, it could be a little darker, it could be itchy and red. And essentially, a keloid is when it's an over-aggressive response to the healing process, and that scar, the keloid scar, essentially is wider than the original incision. It's larger, and it's very uncomfortable. It can be painful, and it's very difficult to manage. I mean, it's not just a procedure where you just cut the tissue out. It can often come back. You have to end up. Scar creams do not help in keloid situations. You need to do surgical revision, often inject steroids, and sometimes even consider radiation therapy to really calm down that tissue, because it's very hyperactive and high response rate of abnormal tissue. So,
are they usually connected with an infection, or is there it's just the?
No, infections are it's not necessarily no. Keloids are really, there's no direct correlation between a keloid and infection. Although people that undergo burns, like a second or third degree burn, are at more risk for an infection. And there's some thoughts that perhaps that infective component from a burn can actually create more of a risk for hypertrophic scars. But I don't believe, to my knowledge, that there's a direct link of infection to keloid scars, although there's a link, and if there's an infective tissue from someone that's burned or for a surgical response, that their scar can be more hypertrophic, meaning just thickened and abnormal, but not so much a keloid. But I guess there's a possibility that I'll look into it and let you know.
Okay, just curious. Okay, and then I think you already addressed this one, but I was going to ask, how long does it take for scars to heal? You said 2 years-ish?
Correct. Yeah, it depends on, again, each patient, but generally how do you define when a scar is finally healed, right? So being that I work with scars and scar creams, and people always ask me, well, when should I use Skinuva scar cream? Is it, can I use it? I have a scar that's 5 years old. In general, the answer is no. Generally speaking, when a scar has matured, it's flat, it's usually white, it's not red anymore, it's not indurated, it's not itchy, dried, painful, it's not pigmented. Those qualities still exist, and the scar is a couple years out. You could still argue that it's still maturing, and there's a possibility that a scar cream like Skinuva can perhaps help in improving, or other treatments such as a laser resurfacing may help. Microneedling can help. These are techniques where you can apply on the scar, kind of resurfaces and helps allow for that scar to thin out and improve with time. It restructures the collagen. And generally speaking, though, it's quite variable. Some patients I see from just a blepharoplasty, after 6 months, the scar is like what I'd call mature. Others can take more than 2 years.
Okay.
It's really fascinating.
And since we're talking a little about Skinuva here, I'm just curious, could you tell us a little bit about how it works and how it's different?
Yeah, I mean, so when it came to developing Skinuva, I had an innovative thought of developing a product that can help improve scars better than what I currently saw in the market. We know silicone cream works. So we haven't really touched upon, I know we're running short of time here, but in general, when it comes to when I manage a scar, you want to keep that scar hydrated. You want to keep that scar with some sort of barrier. And silicone cream obviously works incredibly well. We have literature that supports that. But there's these other ingredients that I was curious about, such as specific growth factors that we talked about when the wound heals through the inflammatory phase. Those growth factors are released. So I chose, or my team chose, specific growth factors that were the ones that are more the favorable growth factors to allow for that scar to heal as favorable as possible. And other ingredients such as vitamin C, Centella asiatica, hyaluronic acid, aloe vera. These are all well-known ingredients in addition to silicone cream that have been shown to help scars, help burns, like for instance from CO2 laser burns or even a sunburn. And so the cream aspect is very powerful when it comes to healing a scar. In my opinion, scars should have some sort of barrier and hydration method after a couple weeks from the procedure, whether it's silicone cream, whether it's Skinuva, or whether it's a silicone strip that keeps that wound moist. So it helps improve the itchiness, it helps improve the dryness. It allows for the skin to be in this moisturized environment. So its own growth factors, its own ability to heal is optimized. And that's one of the reasons why I wanted to add Skinuva to this portfolio for my patients, because I wanted to offer, in my opinion, the most advanced formulation that I can offer to my patient based on studies. And so we've been fortunate to have this product available to patients now for 2.5 years. It's fantastic. We have 5 published studies on it that support its safety and efficacy, and we did a head-to-head trial against regular silicone cream and a paper that was published in ASJ, and we did find that there was a significant improvement in the scars treated with Skinuva versus silicone cream. So it's a great option for patients to use. It's safe to use long-term, and it's kind of the history and story of why we developed that scar cream.
Okay, great. Well, you know what? I think we could actually just keep on talking because there's a lot about scars, and I know we didn't even get through all the things that we wanted to discuss. So we're actually going to do a series on scars and bring you back in the future.
Thank you.
I believe we had some comments, but we've run out of time. So the next time, let's, if anybody out there has some questions about scars, send them in or put them on one of our social media channels, and we'll get it together and we'll talk more in the future and real soon.
Yeah, wonderful. Yeah, absolutely. If there's comments you have, you can send them over to me, and I'm happy to respond through Instagram and then share them with your account. So at least we have an ability to answer some of the questions that we're not able to get through today. So
Perfect.
Thank you.
Perfect.
Yeah.
Thank you.
Great. Well, thanks for having me, Beth.
Okay. Bye-bye.
All right. Take care. Thank you. Bye. Bye.